In your mind, you are hopeless, helpless, worthless, and maybe even feel like a nobody in everyone in your life. I take everything you love about life and make nothing matter. I can take the lives of so many people around you right from under you, and I don't discriminate against anyone in society. What am I talking about? It's depression. Not only have I been diagnosed with depression myself, I became a psychiatric nurse to better help patients understand what depression is and how to cope as well. The purpose of my speech is to help the audience gain knowledge about what depression is, causes, symptoms, and treatments. According to an article written by Gallup in 2017 in Live Science, in 2015, 16.1 million U.S. adults have experienced a depressive episode or a depressive symptom within the past year, making this one of the most common mental disorders in the U.S. What is depression? According to the National Institute of Mental Health, depression is a mood disorder in which severe symptoms affect how you feel, think, and handle daily activities. Depression is not something to be taken lightly. National Health America 2018 reports that 30 to 70% of suicide victims suffer from major depression or bipolar disease. Now let's look at some of the causes of depression. It's not exactly known what causes depression, but many factors could be involved. Mayo Clinic 2018 suggests possible factors such as biological differences, brain chemistry in which neurotransmitters and neural circuits are not working properly in maintaining your mood stability, hormones which help the body's balance is changed due to postpartum, thyroid, or menopause, inherited traits in which depression is more common amongst blood relatives suffering from depression as well, and traumatic life events. My depression is mostly due to inherited traits, which most of my family has been diagnosed with depression and seems to be triggered with life events such as a loss. Now that we have talked about some causes, we have to look at some symptoms you may be experiencing that medical professionals will be looking for. This disease is different for everyone, so the symptoms are different for everyone. Some of these symptoms include feeling sad or empty, loss of interest in favorite activities, overeating or undereating, oversleeping or undersleeping, feeling hopeless, helpless, worthless, anxious, irritable, having aches or pains, and thoughts of death or suicide. If you have thoughts of death or suicide, you need to talk to someone or call the suicide prevention line, which is open 24/7, and you don't have to say who you are. Also, go to your emergency room if those things don't work for you. Once diagnosed with depression, your medical professionals will be looking for what treatments are going to work best for you. Many people that have depression have recurring episodes, or eventually depression becomes chronic. According to an article written by Holland, Face, and Markowitz in PubMed, treatments for depression are antidepressants, electroconvulsive therapy, in which uses for severe depression or if interventions are not working. Also, interpersonal psychotherapy, which improves your social relationships and interpersonal skills. Cognitive behavioral therapy, which is mostly used for acute distress and only works as long as you're going to therapy. Doctors believe that psychotherapy, treatment, and medicine is the best treatment. Everyone that goes through depression is a different case, but we have talked about what depression is, possible causes, symptoms, and treatments for the disease. Depression is a challenging battle. People suffering from depression need to remember a couple things. Don't ever give up. There's always someone to talk to, and you're not alone. Depression is a battle that can be won. Thank you.